Zoonotic Disease Control, a comparison of the United States versus Iraq as far as a country comparison on how they deal with zoonotic diseases, by Ashley Volley, course ATE 4701, St. Petersburg College, Dr. Wendy Ribb, professor. A general outlook on how the United States handles zoonotic disease. These are the different government agency bodies that partake in help deal with zoonotic disease. We've got the CDC, USDA, USGS, DHS, NIH, as well as all of our state and local health agencies that also deal with zoonotic diseases. To look at Iraq as a comparison next, they actually only have 2 government agencies for their entire country that deal with things like zoonotic disease. That's the Ministry of Health and Ministry of Agriculture. So right there tells you the big scope of how much the United States takes zoonotic disease seriously and how many people are actually involved in it compared to that of Iraq. Views and beliefs and how they play a role in all of this. So Iraq, these rural people view health and disease quite differently. Iraq people have different cultural beliefs, religious beliefs, and views in general compared to that of the United States. These differences do affect how they partake and their willingness to actually deal and partake in things like zoonotic disease as far as the prevention, mitigation, relief efforts. Comparing that to the United States, where in general there's a huge support from the general public in healthcare. 71% of a statistic showed that they were in favor of increasing federal spending on improving the nation's public health programs. So what this is basically showing is that the United States people in general deem public health as a very important thing, and they, want things to be done. So they promote government agency involvement and taxpayer spending on these types of programs. Whereas in Iraq, it's not really a big thing for them. They don't see it as being super important. Poverty plays a role. So Iraq is not considered actually a poor country in general because of their rich oil economy, but statistically, their poverty level is extremely high. According to the World Food Program, the poverty rate in Iraq in 2020 was 31.7%, whereas a recent finding for the poverty rate in the United States was 10.6%, which I found that on census.gov. So this shows, there's like a 20% difference in our poverty levels between the two countries. Urbanization. Infectious diseases thrive and spread more rapidly in urban areas, especially in areas with overcrowding and poor waste management. As we all can see in the United States, there's constantly waste management services everywhere. They come and collect our trash at our residential homes. There is different facilities that provide for disposal of waste products. And whereas in places like Iraq, there's trash everywhere. Trash all along the roadways. The air is, as Chris Volley, which is actually my husband, he was a veteran that served during the Iraqi Freedom War in 2009 to 10. While he was overseas in Iraq, he literally stated that there's trash everywhere, trash all along the roadways. They don't have waste management services appropriately or adequately in place in that country to help with this issue. So waste is a huge problem. Comparing rabies. So the canine variant has been pretty well eliminated in the United States. Our rabies cases mostly are stemming from wildlife at this point. The cases that we have seen canine variant in the United States are actually coming from dogs or people that have, came from other countries. Iraq. Free roaming dogs are considered the main reservoir for maintaining the rabies virus. So, there's dogs running around Iraq everywhere. My husband could even vouch for this while he was in his tour. Dogs everywhere. Rabies is estimated to cause 59,000 deaths per year, 99% of them being from dog, which, as we all know, rabies is 100% preventable by vaccine. This is just a great way to show how rabies is affecting and being handled by both countries. Concerns. So we've all witnessed how easily a zoonotic disease can transport itself through countries. COVID-19 was a great illustration of that, with it stemming from China and then, making its way to the United States and other countries around the globe. With travel, transportation of goods, and animal migration, spread of disease is always possible. So zoonotic disease is a huge concern globally. Roles of vet techs and veterinary professionals. We need to understand that cultural and religious differences play a vital role in a person's decisions concerning their human health as well as their animal health. We need to learn how to navigate those differences and do so civilly and with respect. Education is a huge thing. We are front and center on educating the clients that we have and who we can about the concerns of zoonotic disease. Collaboration is a big one. We need to collaborate with our local community as well as, try to get involved in a broader aspect of it. Understanding and working with financial constraints of our clients. And we need to also take it upon ourselves to learn and promote about the programs and services that are offered in our community to help those that are facing financial hardships. Problem in Iraq. Iraq is not the only one. There are many other countries that are similar that are facing these big issues, and it's all starting with their infrastructure and government. Some of these countries just don't place zoonotic disease in the forefront of an issue. There needs to be an improvement in public and animal health sectors globally. Veterinary care and vaccinations, these resources need to be increased. Collaboration. So from what I've read, these two government bodies in Iraq are not collaborating well. One deals with animal health, one deals with human health, and they're not collaborating well. So that needs to be increased. We also need to work to eradicate vectors. Vectors are a big thing with disease transmission. There is a mass amount of mosquitoes and other vectors over in the Middle East that are causing serious problems. Waste management. Obviously, we discussed that earlier. Waste management is a huge concern in the country of Iraq. That needs to be improved. Continue to advocate a one world, one health approach. We need to do this. Advocate all these countries to join and utilize organizations such as the World Health Organization. There's a lot of countries that are already involved in this group, but obviously it'd be great to be able to get everyone to be involved in this. Collaboration, all agencies in all countries concerning human, animal, and environmental health. These are my resources. Thank you.